Right, this skill is to apply direct pressure to a wound on your patient. To apply direct pressure, when you initially observe it, if you don't have it immediately available, you can use your gloved hand. Standard precautions are always taken. Once you're able to, you can apply a dressing that's 2 to 3 inches thick. It could be 4x4 gauze, or you may choose to use something like an ABD pad. An ABD pad will have a blue stripe on one side that indicates it's away from the patient. However, you may choose to fold it in half and put the clean side against the patient's wound. Applying direct pressure. Keep direct pressure on the wound until the bleeding is under control. Once the bleeding is under control, you'll need to affix it to the patient, and you can affix it either by tying a triangular bandage to it, taping it in place, or in this case, we'll use roller bandage, otherwise brand name, this is Kerlix, and we'll apply it. You'll need to start by applying a lock loop to hold it in place. That'll keep it from twirling around, and always try to roll away from you. There's less risk of you dropping the actual Kerlix in that case. Cover the entire wound, and as you do, pull it tight. And by pulling it tight, it will assure that the pressure is maintained on the wound. Now at this point, you could either choose to limit the amount you put on by simply taking a pair of EMT shears and cutting it and simply taping it or tying or tucking it in place. However, if it's a larger wound, you may go ahead so that you can get the tightness you want applied to it and use the whole amount of Kerlix. I'm going to tuck this in place rather than using tape. And once it's tucked in, be sure and come back and make sure you haven't turned a tourniquet by checking the distal pulse on your patient. I'll also check his capillary refill. And we might consider sling and swath in order to further stabilize this and limit the amount of hemorrhage the patient might have.